I'm Alexandra Garcilaso from Mexico. Today, Friday, here in San Antonio Breast Cancer Symposium, we have the Rapid 5 session where we review a study focused on the homology recombination repair pathway. I will comment on 3 very interesting studies for patients with alteration in this pathway. In the neoadjuvant setting, the results of TBCRC-056 study were presented. This is a phase 2 trial evaluating the combination of niraparib plus dostarlimab in patients with triple-negative breast cancer who carry a germinal pathogenic variant in BRCA1, BRCA2, or PALB2. The rationale for combining dostarlimab with PARP inhibition is that PARP inhibitors trigger intratumoral activation of the pro-inflammatory STING pathway, which attracts CD8 T cells and sensitives BRCA mutation cancer to immunotherapy. A total of 46 patients were enrolled, 37 with clinical stage 1 disease, 45 stage 2, and 26 patients with stage 3. Patients received niraparib once daily and durvalumab every 3 weeks for a planned of total 80 weeks of treatment. The median age was 39 years. 82% of the patients complete all planned cycles and 6% experienced progressions. The most frequent grade 3 adverse events were anemia and neutropenia. In terms of efficacy, 50% of patients achieved a pathological complete response, and increase in stromal tube infiltrated lymphocyte stills was confirmed after treatment, with average rise 11%. PD-L1 scores were not associated with response. These findings support the potential effectiveness of combining target therapy with immunotherapy. These populations also identifying the best candidates for chemotherapy-free regimens remains essential. The other study, the phase 2 Olympian study, include patients with early triple-negative breast cancer and BRCA mutations who received neoadjuvant olaparib monotherapy for 6 cells with or without durvalumab. Patients were divided into cohorts based on clinical stages. Cohort A include very early tumors, T1B or T1C, treated with olaparib monotherapy, while Cohort B include patients with T2 and 0 or T1 and 1 disease treated with olaparib plus durvalumab. Treatment duration was planned to 4 to 6 cycles per surgery. Patients could achieve a complete pathological response continued with 6 additional cycles of olaparib. Those with residual disease received standard adjuvant therapy according to local practice. A total of 50 patients were included, 25 in Cohort 8 and 25 in Cohort B. In Cohort 8, 92% complete treatment when patients progressed, and the pathological complete response rate was 68%. In Cohort B, 84% complete treatment, 2 patients progressed, and the PCR rate was 80%. Grade 3 adverse events occurred in 24 patients, with anemia being the most frequent. These results support further development of PARP inhibitor-based neoadjuvant approaches. Continued with PARP pathway, it's recognized that germinal BRCA mutations alone don't capture all tumors with homology recombination deficiency. Therefore, evaluating the predicting value additional biomarkers such RAD51, it's necessary to refine PARP inhibition sensitivity. The SOLTI Radiola study is a multi-center phase 2 trial including patients with metastatic HER2-negative breast cancer who had received fewer than 2 prior lines of chemotherapy. The trial includes 2 cohorts. Cohort 1 enrolled patients with pathogenic variants in BRCA1, BRCA2, PALB2, or RAD51. Cohort 2 include patients without pathogenic variants or without unknown status, both classified as HRD deficient, defined as fewer than 10% RAD51 positive cells. All patients received olaparib. The primary endpoint was objective response rate, and secondary endpoints include safety and progression-free survival in Cohort 1. 55 patients were included in Cohort 1 and 10 in Cohort 2. In Cohort 1, the objective response rate and progression-free survival were higher among the patients with low RAD51 levels compared with those with high RAD51 expression. These findings show that the RAD51 assays improves prediction of PARP inhibitor response in patients with pathogenic variants in DNA repair genes. In summary, these three studies reinforce the growing role of therapies targeting homologous recombination report in triple-negative breast cancer. SABCS'25 and Olympian show that PAP inhibitors alone or combined with immunotherapy can achieve high pathological complete response rate in selected patients with PRCA or PARVL2 mutations, even without chemotherapy. Meanwhile, the radiol study shows that RAD51 biomarker enhances identification of tumors truly sensitive to PAP inhibition beyond germinal BRCA testing. Together, these findings move us close to more precise biomarker-driven treatment strategies. Thank you.